Acute ear pain is most commonly caused by an exacerbation of temporomandibular disorder. Say that fast. All right, here we are at the Movement Science Center. Let's go meet Dr. Cedor. Dr. Cedor.
Dr. LaCour.
What's up, man?
Thanks for coming.
All right, so a question I have is it TMJ or is it TMD? Because I always say TMJ and I think I'm wrong.
It's one of the funny, not so funny jokes that I share with my patients often. They'll come in and say, Dr. Cedor, I have TMJ. I'll say, congratulations, I have a knee.
That's not funny. That's not funny at all.
So it's
We
not
both
TMJ.
have two TMJs.
Okay.
TMD is the disorder that some people present with.
Can you show me like the easy ways that you diagnose this?
TMDs are super common. It's one of the more common diagnoses of pain that we feel in the jaw, in the face, in the head.
Okay.
That's not related to teeth.
Okay.
More often than not, they're going to go to see either you because they may have ear pain, or they're going to go to see their dentist. A lot of times this can be driven from muscles. There's some primary muscles in the face. There's one called the masseter right here, and there's
Right.
one called the temporalis that's pretty visible with my follicularly challenged head right here.
Got it.
But one of the things that we look for is when do they have the symptoms? Do they have the symptoms around things that involve jaw activity? So chewing, eating, smiling. Sometimes people will come in and they'll complain of headaches in the morning. A telltale is if they report their headaches in this area, which is literally right over the top of the temporalis muscle. So a real simple thing is just to palpate in those muscles, to feel in those muscles for what we call trigger points, which are active areas of contraction that can cause pain.
Okay, cool. Would you mind showing them on me?
Be happy to. What we'll typically do is palpate in where those muscles run. So the first muscle that's the most commonly involved is called the masseter.
Okay.
There's a prominence on the mandible called the angle of the mandible. In between that and this bone right here, the cheekbone, the zygomatic bone, is the trajectory of that muscle. So if you get patients to bring their teeth lightly together, and I try to emphasize lightly, that muscle will pop up under your fingers. And so I'll usually follow the course of the muscle and just find if there's any tight bands, and I'll put a little pressure through that.
I've got it.
And I'll ask the patient, does this reproduce what you would consider to be the pain that brings you here to see me today?
Okay, got it.
That'd be for the masseter. The temporalis is similar. It's a broader muscle. It runs kind of from just behind the eye all the way back to behind the ear, and it's kind of like a fan. So I'll kind of run my fingers through and I'll see if I can find points along the same point, and I'll apply pressure, and I'll again ask the patient, does this reproduce anything which you consider to be your familiar pain?
Okay.
If they talk about that's actually the headache I've been having,
Yes.
that's what would be classified as headache attributed to TMD.
So I've got this, okay? So I know this is kind of your wheelhouse. So typically, do you go straight to dry needling, or is there something like exercise? Like, let's say they're at an urgent care ER and they have this. What could they do to kind of help temporize the pain besides anti-inflammatories, warm compresses?
Sure. So heat's always good. One of the things that we try to determine is if the patient has what are called parafunctional behaviors.
Okay.
So normal function of the jaw is talking, chewing, ancillary involvement in swallowing. I want to know what other things do they do. Do they chew on ice? Do they chew gum? Do they bite their nails? Anything where they're using extra input into that system is going to be something we want to try to decrease the amount of. If they're super inflamed, I'm going to want to try to guide them towards maybe a soft diet.
Okay.
Try to avoid the big po' boys, We'll start with a little soft tissue massage and soft tissue work, and if there's a relevant place and the patient is open, we do have a technique we utilize quite frequently and effectively called dry needling. Dry needling is not acupuncture, it's not putting anything in your skin. It uses the same type of needle as an acupuncture technique, but we use it to facilitate a reset of the muscle. It's very quick, it's a very efficient way to reset and get those muscles to go out of spasm.
So for the last week, I've been having this thing right up here in the temporalis. I think it's TMD, okay? Would you be open to testing me out and needling me?
Sure, let's do it.
Let's do it.
We'll get you to lay back up on your back.
Okay. All right.
And the first thing that we'll do is just see if you have, in fact, an active spot in your temporalis.
Oh yeah, right there.
And that's a familiar pain?
Yes.
Okay. So these are single-use sterilized needles that we dispose of. Contrary to popular opinion, we don't use a microwave.
Okay, that's good.
So what we'll do is we're just gonna go ahead and clean the spot that we're gonna work on.
Okay.
The temporalis is pretty superficial, so we're gonna be going just
right there.
Parallel to your skull. So it's a little tap.
That was it.
What we achieved and what you probably felt was that little bump in the muscle.
A little twitch.
Right, so for the next 24 to 48 hours, that muscle will start to relax and reset.
Okay.
And that has to do with what's called the muscle spindle, which is a little dimmer switch that we can affect with the needling in your muscle.
I can't tell you how many times urgent cares and ERs are seeing patients that come in with ear pain, and unfortunately they're not too sure what they have, so they'll get diagnosed with ear infections and they don't have them. And so this is a great tip to give to them so that they know what to do and where to send the patient. So thanks so much for having me.
Absolutely.
So now you know, when your adult patients come in with acute ear pain, check their temporalis, check their masseter. There's a good chance this is causing their pain. For more content like this, please like or subscribe to our YouTube channel. Thank you.